Hey everyone! Today, let's dive into something super important but often overlooked: aortic dissection. This silent killer can strike without warning, so it's crucial to know the signs and symptoms. Ready? Let's jump in. First off, imagine this. What if your main artery, the aorta, just started tearing from the inside? Yeah, scary thought, right? That's exactly what happens in an aortic dissection. It's when the inner layer of the aorta tears, causing blood to flow between the layers of the artery wall. If it bursts through the outer wall, it can be fatal. So, how do we diagnose it? Well, it's tricky because the symptoms are often mistaken for other heart issues. Doctors use imaging tests like CT scans, MRIs, or transesophageal echocardiograms to get a clear picture. Early diagnosis is key to survival. Let's talk symptoms. They can hit you like a ton of bricks. Sudden, severe chest pain that feels like tearing or ripping. Pain that radiates to your back, jaw, neck, or arms, shortness of breath, and even fainting. If you or someone you know experiences these symptoms, call emergency services immediately. Now, who's at risk? Aortic dissection is more common in men, especially those in their 60s and 70s. High blood pressure, hardening of the arteries, and certain genetic conditions like Marfan syndrome can increase the risk. Lifestyle factors like smoking, high cholesterol, and obesity play a role too. The incidence rate is relatively low, but the stakes are high. About 5 to 30 cases per million people each year. Men are more likely to be affected than women, with a ratio of about 2:1. While it's rare, it's incredibly serious. Survival rates improve drastically with early detection and treatment. Without treatment, the mortality rate can be as high as 50% within the first 48 hours. So, catching it early is literally a lifesaver. In conclusion, aortic dissection might be rare, but it's nothing to take lightly. Knowing the symptoms and risk factors can make all the difference. So, stay informed, stay healthy, and see your doctor regularly. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell for more health tips. Stay safe, everyone.